Now, concerning new data for parents when it comes to the Omicron variant and children. Children's hospitals across the country are reporting pandemic high hospitalizations. And right here in Connecticut, we've learned 17 children at Yale-New Haven Children's Hospital have COVID. 5 are in the ICU, and there are another 17 at Connecticut Children's. To talk to us more about how this variant is impacting children is Physician-in-Chief at Connecticut Children's, Dr. Juan Salazar. Dr. Salazar, as always, very nice to see you.
Erin, good to see you and happy to share some information with parents.
Yes, Happy New Year to you as well. Unfortunately, though, these numbers not leading to a Happy New Year for many. Today, reporting that our positivity rate for PCR tests nearly 24%. In terms of the children, a lot of parents very concerned, of course, about their kids. Do we know how serious right now these hospitalizations are at the various hospitals across Connecticut?
Yeah, thanks, Erin. So again, I've always said this throughout the pandemic, we can't panic. We have to be logical, follow the recommendations that have been made by the Centers for Disease Control, the recommendations we have made at Connecticut Children's. And so for parents, I don't want you to panic. Yes, it is true. This variant of COVID-19, Omicron, is affecting children in a higher proportion than in the past. We have many kids who have been infected. Fortunately, most of them are not very sick. Most of them have a simple flu-like illness, a cold that does not require hospitalization. Now, having said that, some kids have ended up in the hospital. So we, as you mentioned in your opening remarks, 17 kids are hospitalized currently at Connecticut Children's. The good news is that the majority of them have obviously enough of an illness to be hospitalized, but they're not seriously ill. Some kids do end up in the intensive care unit and do require more services. The majority are not. So this is behaving more like what we would see with a typical influenza-like illness, an influenza-like year with often in the influenza years, we've had 20, 30 kids hospitalized at Connecticut Children's. So it is a little different than it used to be. It's not as severe as what we saw in the adult population with the early phase of COVID-19 or the Delta variant, but it is affecting kids. So my recommendation to parents right now is go ahead and get your kids vaccinated. If they're over the age of 5, they can get the Pfizer vaccine. There are many places where you can get the vaccine. Kids over the age of 12 can get boosted. And the CDC now is recommending a booster. And as of this afternoon, kids with immune conditions, other underlying conditions who are 5 to 11 should also get a booster, and they can get a booster 28 days after their last dose of the vaccine.
I think a lot of what you said is probably a relief to parents like myself. However, there are those incidents of children in an intensive care unit. My question about what about children under 5? And what about children in general? It seems like are kids more at risk from Omicron, or is this just because Omicron is a highly transmissible variant compared to what we have seen in the past?
Yes, it is incredibly transmissible, if you may say. This is 5-6 times more transmissible than the Delta variant, and we have seen it. And what we're seeing now in Connecticut specifically is the result of our social interactions that occurred starting in Thanksgiving, Hanukkah, Christmas, certainly New Year's. And so we will see, this is the way respiratory viruses transmit. We will see a peak probably within the next week or 2 weeks. We could see as many as anywhere between 15 and 20,000 infections a day across the population. Many of those are going to be kids because kids have not been vaccinated, especially under the age of 5. Again, I want to emphasize most of the kids will be fine. It is important if a child has a respiratory illness that you connect with your pediatrician, that you seek testing when available, but please do not panic. Be sensible, be responsible, do not panic. You make use of the vaccines when you have them available to you, and then ask your pediatrician for questions, and we'll make it through. We have made it through so far, and we'll make it through this Omicron peak as well.
And last question for you, Doctor. It's obviously a tricky time of the year. We're talking about winter where there's colds galore, of course. We're also talking about the flu right now and then Omicron. So if parents are watching right now and any of their children develop any type of symptoms, be it for cold or flu or potentially COVID, what's your best advice to them?
Yeah, that's a great question. And right now, my recommendation would be to follow the typical recommendations that you've done in the past. If it's a mild illness, The kids are not very sick. They're not experiencing any serious conditions, or they don't have an underlying illness. I would have a phone call to your pediatrician and just ask them what they're doing in their clinic. Obviously, if the child looks sicker, they have a high fever, if they have an immunocompromised state or any underlying conditions, then you should seek care either through your pediatrician or one of the urgent cares or the emergency department. For the most part, you don't need to do that. Obviously, there are testing capacities. You can do in-home testing if you want to find out if the child has COVID or not. And do report that to your pediatrician so that they can give you some additional advice. Again, for the most part, general recommendations. This is a little different than what we saw with Delta or the original COVID variant. Do not panic, seek advice if the kid is looking sicker. And if you follow those directions, I think you're going to be just fine.
Well, I think your message is very important. And obviously, as we have throughout this entire pandemic, we really appreciate your time and your knowledge that you're offering all of us. So Dr. Juan Salazar with Connecticut Children's, thank you so much.
Thank you, Erin. Take care.